I've faced stigma related to my condition pretty much my whole life, sadly within the medical profession as well as from wider society. I've missed out on career opportunities, I've been treated as a liability when I've been unwell at work, and I've been made to feel like I did something wrong, which only feeds into the shame and stigma of the condition itself. I'm a doctor, so I practice nephrology, which is kidney disease. Outside of medicine, I like reading, I do a lot of creative writing, I play piano as well. I'm a passionate mental health advocate. I've done a lot to try and destigmatise mental health so that people understand what it feels like to be a patient living with bipolar disorder. We have to be the change that we want to see in the world. And I want to see a world where open disclosure is commonplace. I don't think I've ever heard a colleague openly admitting to not coming to work because of mental health issues. We're much more game to say I've got a migraine than I have anxiety. And so I made it a policy for myself that I would openly disclose for every job application and be upfront about my mental health condition. At a systems level, I think first and foremost we need education and understanding around what mental health conditions look like. And there really needs to be a sense of safety and a culture of discussing mental health conditions in the workplace. We've got a much better chance of actively helping people if we understand their conditions, if we talk to them about it, if we create a space of sharing and vulnerability so that employees will feel comfortable openly disclosing their condition. These sorts of policy changes and discussions have to come from the top down. Stigma has definitely affected my confidence because I'm someone that prides myself on at least trying to be a good person. And when you're manic, you do a lot of terrible things and you say a lot of terrible things that you don't necessarily mean. I felt a need to apologise to so many people for so long. Eventually, when I got more confident, I realised, why should I have to apologise? Why should I have to apologise for a genetic condition that was triggered for whatever reason? Someone with cancer who relapsed wouldn't have to apologise. They would get sympathy. They would get cards and flowers. When I relapse from my mental health condition, I don't get cards and flowers. I don't get sympathy. I get met with stigma, shame, and all sorts of stipulations on career practice. So the difference in how I would be treated if I had a physical illness is worlds apart. My vision for mental health would be to legitimise it and to treat people with the same tenets of respect, compassion and kindness that we would expect of someone with a physical illness. I want to see the same level of research, support, impact, education and understanding around mental illness so that we can live in a more culturally evolved society that doesn't discriminate and treats people equally as they should.